So a degenerative spinal disorder is essentially an age-related disorder of the spine. So essentially it's similar to developing gray hair or developing wrinkles. The evidence suggests that our spine, the optimal physiology of our spine occurs up until the age of 20, where it stops growing. And after that, there's gradual decline, as with any aspect of our health. So essentially, it's a disorder which is age-related due to wear and tear, essentially, to use such words, and it can involve any aspect of the spine. So it can involve the facet joints, the discs, the muscles, ligaments, or the neural structures within the spine. And essentially, when this manifests itself in terms of symptoms, it results in pain, dysfunction, affecting the quality of life and ability to function normally. So essentially, once the diagnosis of a degenerative spinal disorder is established, the reason for such is that patients often have pain and limitation in their quality of life as a result. So on the whole, if someone has a degenerative spinal disorder, it depends on the symptoms that they have. But most often than not, most patients can manage this themselves with regular exercise, maintaining their fitness, ensuring that they are of adequate weight, and essentially pain management. However, if these methods are not uh, uh, resulting in an improved quality of life by controlling the pain, then we can consider further interventions where referral to a spine specialist may be necessary. I think that the reality is that everyone, as we get older, develops degeneration or age-related changes, as I like to call it, within the spine. If we're to scan patients off the street who are completely asymptomatic, quite a lot of them would have radiological evidence via an MRI scan or X-ray of degenerative spinal disorders. However, the issue is when this becomes symptomatic and starts affecting patients by causing them pain, affecting their quality of life, their comfort, and their function. So often patients would present to their GP, for example, with back-related problems. This may be back pain, which can be mechanical in nature. That is to say that it's improved when they're lying down and made worse by sitting, standing, or walking in activities. Or they may have, most commonly, nerve type pain, where they have sciatic type pain, which is as a result of compression of the nerves within the spine, which results in pain radiating down the arms or the legs, affecting their quality of life, their comfort, and their function. So once patients have such symptoms, they're often referred for further assessments. This can be either via imaging or referred for a specialist assessment by the spinal service. And the MRI scan then confirms the diagnosis. So degenerative spinal problems are quite common amongst the population. It's only when they start becoming symptomatic and causing symptoms is actually where a degenerative spinal disorder would be formally diagnosed. So in my opinion, the best treatment is conservative measures, which involves patients engaging in fitness activities, secure in the knowledge that although their back or leg may hurt, they're unlikely to do any structural harm through sensible and regular exercise, supplemented with simple pain relief, such as paracetamol and or Nurofen. Now, despite a good exercise program and good quality pain control, if their symptoms still persist, then further treatment can be directed to this. And this can range from injections or targeted injections to nerves which may be affected, to decompressions or fusions. But in order to answer your question with regards to the best treatment, again, it's difficult to answer that question because the degenerative spinal disorder involves a wide range of pathologies. But in my mind, the best form of treatment is through sensible and regular exercises, supplemented with simple painkillers. And if this is not effective, then surgical treatment, and the type of surgery does vary depending on the type of pathology that's present. Most definitely. And again, most patients who have degenerative spinal disorders on imaging are really asymptomatic and therefore do not have symptoms with it. In those that do have symptoms, the aim of treatment is to improve the pain, the quality of life, the comfort, and the resulting function. As a result, patients who have symptomatic degenerative spinal disorders, my first port of treatment would always be to try and improve their core strength, improve their activity, improve their function, aware that actually their back may hurt, but they're unlikely to do any structural harm through sensible and regular exercises, supplemented with simple painkillers. Only if such measures are not successful, then can further treatment be directed, which can range from injections or targeted injections to spinal surgical intervention. So degenerative spinal disorders, as discussed previously, are age-related changes. So thereby, degenerative spinal disorders can never be cured because once age-related changes are identified, then essentially they tend to progress. However, not all patients are symptomatic from this. So therefore, we can improve patient symptoms as a result of degenerative spinal disorders. And the best way to manage this is through sensible and regular exercise. However, if this is not effective, then surgical treatment can be directed in order to try and improve the symptoms, but essentially will not cure the underlying degeneration or age-related changes of the spine.